Hi everyone, welcome back again to Smart Innocent YouTube channel, and I wanted us to start from intradermal route of drug administration. So when we mention intradermal, what comes to mind? The first thing that should come to mind is inside the skin, since we already know from the dermal already meaning dermis and the intra meaning inside. So we're talking of taking a drug administration inside the skin. Starting from the intradermal route, when we consider the anatomical diagram of the skin, we can see that it starts out from the epidermis to the dermis, and the dermis contains a lot of blood vessels. This red signifies the arteries and the green signifies the veins, and finally the subcutaneous region of the skin. But when we talk about intradermal route of drug administration, we are mostly considering inside the skin, and this dermis is the larger part of the skin. And because of the presence of blood vessels and arteries and veins in the dermis, so it means that just a small amount of drug is needed for there to be maximum absorption. You can see I already wrote down here 0.1 to 0.2 ml of drug products can be given through a needle via a syringe. So the routes of this intradermal drug administration mostly given at the inner forearm, and most of the times the reasons why people give this drug is either to assess for disease or disease screening, or it can also be used for local anesthetic prior to the venous cannulation. So apart from the inner forearm, it's also administered via the non-hairy skin of the upper back. And this depends on specific kind of medications where patients are administered in this route. So because of the presence of the blood vessels, it has greater absorption compared to the subcutaneous. So what it means is that a lower amount of drug is going to be given intradermally compared to the subcutaneous route of drug administration. So when we come to the subcutaneous route, we want to go deeper, and we want to go as deep into, would cross the dermis and then into the subcutaneous region. If this is my upper arm and I would like to administer this into my upper arm through intradermal route, you'd see that you would just have to just check through, or the angle of insertion would just have to be 15 degrees. But when we're talking of in subcutaneous, you want to get deeper into the skin. And this varies depending on the size of the patient or the weight or the body mass of the patient. So we're going to be considering all of these things while administering a medication subcutaneously. So subcutaneous route of drug administration delivers medications into the deepest layer of the skin. An example of drugs are given this way is the insulin, the heparin, and the vitamins. Particularly when you're giving a drug through the subcutaneous route, it is very advisable to change sites of insertion depending on the times. So if this was given at this site, you change to another site or another part of the body. Because this is deeper compared to an intradermal route, you'd see that it will need a better angle of insertion because we are going deeper into the skin. So most of the times, the angle of insertion that is used for subcutaneous is 45 degrees. Although now, a lot of pharmaceutical companies are producing injections that are particular to subcutaneous route, and those kind of injections, they just have a very little needle site. So you don't need to create the angle of 45 degrees. You just need to inject the drug product in the right manner. So if the patient has a large body weight, when we are considering the weight of the patient, if this patient is obese, you just have to give it in a 90 degree. And why 90 degree? Reason being that this patient have high amounts of body fat. So 90 degree would be what would take us at the right place we want to be, which is the subcutaneous region of the body. And if it's an averagely weighted patient, you can give it 45 degree, which is the normal route, 45 degree. But if this happens to be a very thin patient, you can punch some part of the skin and give it 90 degree. So the reason for all of this, considering weight, is because we know that different people have different body mass and also different weights. So we consider all of these things during subcutaneous route of drug administration. Finally, when it comes to intradermal and the subcutaneous route of drug administration, you don't aspirate, which we would likely advise when we are talking about intramuscular route, where you have to aspirate to be sure that this is not into the blood vessels, unless it was particularly stated for some part of medications that you have to aspirate to for this particular medication because of the dangerous effects it can have if it mistakenly goes to the bloodstream. Aside that, you don't aspirate, intradermal medications, and subcutaneous medications. We would look at the advantages of giving medications through this route. Our first advantage is that it's available for patients that cannot take drugs. So when we have an unconscious patient, because the whole thing that has to do with swallowing, it requires a conscious effect. A person has to be conscious to be able to take in medications orally. But for a patient that is not conscious, it can just be easily administered. It also avoids hepatic first pass effects and enzymes. So there are a lot of digestive enzymes that particularly in the stomach region, for example, our gastric enzymes, or even the pepsin, the renin, and all of these things act on already ingested food or drugs. So when you administer a drug via the subcutaneous or the intradermal route, it passes all of these things, and this drug is not degraded before getting to the systemic circulation. So a patient is able to have a substantial amount of the drug in the system that would give to the high effects that is considered for the person to regain consciousness or regain health or regain stability. A particular disadvantage is that it requires very small volumes. I don't personally see this as a disadvantage because it's still going to give the effect, because this drug is not going through the first pass effect. So it's still going to give the required and the desired effects that was expected from the drug. Another disadvantage is that it can cause pain and swelling at the injection site. And as a nursing student, it is very important for you to know the right way to avoid creating this effect. So if we already know that, okay, there's a risk for pain and swelling at the injection site, then it's important for you to administer that drug in the right manner to reduce the incidence of pain and swelling. For intramuscular route of drug administration, drug is delivered directly into the muscles, and we already know that anatomically the muscles contain large amount of blood vessels. With this large amount of blood vessels, what are we looking at? We're looking at faster rate of absorption. Just like we spoke about in subcutaneous route of drug administration, there are a number of things that we check for while administering a drug. First of all, one thing that would determine the size, we don't use so much of drug products. Why giving a drug or why administering a drug intramuscularly? Because this is not a oral route of drug administration, so it requires just little for it to get to the blood circulation, because it does not undergo first pass effect. So we would need a smaller amount of drug. The standard amount of drug that is administered intramuscularly is 2 ml, but this depends though. If the patient that is supposed to be given that drug has a large muscle mass, you can administer 3 ml of the drug into the muscles. But if that drug is administered at the deltoid region, at the deltoid muscles, you just have to give 1 ml of the drug, because the deltoid muscle is a very small muscle. We don't want to bombard it with a lot of drug products that would be excess for it. So we'd give 1 ml of the drug dosage. Another thing we consider, just like subcutaneous, we consider the body mass and the adipose tissue. So the importance of you knowing this is not because you are administering the drug, but because you are standing as a watch out for the patient and also for the safety of the patient, and also to reduce the risk of adverse events, as nobody is above mistakes. Now, I wrote a mnemonic here that helps you to learn the sites to avoid while administering a drug. You don't want to give a drug intramuscularly that is close to a nerve. You are looking out, you don't want to get to a nerve. As I wrote this mnemonic here, never look big, and this represents 3 different sites that you should avoid. Firstly, the nerve. You don't want to give the drug close to a nerve. Reason is to avoid the risk of nerve damage. There's a lot of risk of nerve damage when it comes to administering medications, and you want to be on a watch out. You don't also want to give the drug into a large blood vessels, and this is one of the reasons why intramuscular route of drug administration, you always aspirate. Remember that we said that we don't aspirate when we administer drugs intradermally and subcutaneously. We are aspirating here because you don't want the drug to get into the blood vessels. Most of the times when a drug that is meant for the muscle gets directly into the blood vessels, it could cause some adverse events of which you want to watch out for. You don't also want this drug to get to the bones, because that is not the preferred site of the drug administration. The common sites that intramuscular drugs are administered is the gluteal, the deltoid, and the vastus naturalis. While I was in nursing school, I used a mnemonic to learn this, and that mnemonic says, go down very fast. And when we think of go, I want you to think of the word gluteal, go. gluteal. And even when we want to go down, we already know that the gluteal region would be bent to go down. So when you think of that, that's the first thing that will come to your mind. I don't know, but it makes a lot of sense to me. And you go. Now with go, we talk about the gluteal routes. Around the gluteal route, we have the ventral gluteal and the dorsal gluteal. The preferred site for intramuscular administration is the ventrogluteal, is the most preferred site. Reason being that it has a way of avoiding the nerves, the large blood vessels, and also the bones. So it is the preferred site for intramuscular route of drug administration. The dorsogluteal is not a preferred site. It's mostly used for children, but commonly or recently, it has been stopped in some countries. Reason being that the dorsogluteal has a greater risk of sciatic nerve damage if a drug that was supposed to be administered intramuscularly gets into the nerve. We also look at the deltoid region, of which we said, in as much as the recommended dosage for intramuscular is 2 ml, when we are giving a drug in the deltoid region, we want it to only be 1 ml. And finally, the vastus lateralis. I like to describe this as the 2/3 of the lap, and this is just sort of the 2/3 of the lap region, and that is the preferred site for some form of drug combinations. Though for the deltoid region, because we want to give this in a very small amount, mostly what is or drugs that are given through the deltoid region are vaccines, and a common example is the hepatitis B vaccine. So just like any other route, it also has its advantages and disadvantages. A common advantage of intramuscular route of drug administration is faster absorption, and we already know why. Wherever we have a lot of muscles, we have a lot of blood vessels, and if the muscles is very vascularized, it means that there is going to be a large amount of drug absorption. Another thing we're looking at is it has a longer duration of action. This is very simple for you to know why. When you think about the fact that first pass effects will easily degrade a drug before getting to systemic circulation, and the amount taken is not the amounts that finally get into systemic circulation. So what that means is that when that drug finally gets into systemic circulation, we only have a little amount to work with before it is finally degraded through the excretory systems. But when we come to the intramuscular route of drug administration, it has a longer duration of action because it simply does not go through first pass effect. And we want to look at the common disadvantages which most of us will be familiar with. Firstly, it causes pain and discomfort because the intramuscular route is usually the deepest route of drug administration. When I mean deep, I'm talking about the angle of insertion. Remember when we talk about intradermal, we're giving it 15 degree of insertion, and even subcutaneous, we're giving 45 degree. Most of the times, we're administering a drug intramuscularly, it is mostly 90 degree when inserting, and this is because of how deep we have to go before reaching the muscle. So you have to think of the pain that the patient gets to experience and also the discomfort. Another thing is local irritation. Mostly what causes irritation is when it gets to nerves. So irritation to the nerves, even irritation to the skin. A drug can cause irritation. Thirdly, the risk of nerve damage, which we already spoke about, and fourthly, the risk of infection. In general, when a drug is administered parenterally, you have to watch out for aseptic techniques. So because this is getting into the bloodstream, so you have to be way cleaner. That does not mean that you administer an oral medication in such a dirty way, no. But what we're looking out for is the aseptic. We're looking beyond the clean surface. We're looking at a sterilized surface. So you have to make sure that the injections and all of the medications that you're using, the medication is not broken, the ampoule is not broken, the injection is not used, the syringe is not double used, because it has to be one syringe for one patient. If possible, the syringe that is used to withdraw the drug should not even be the syringe that should be used to administer the drug. Another thing you want it to be is that you want to make sure that the site was well sanitized, and also you put on gloves to avoid transmission of infection to this patient. Lastly, I wanted us to talk about the intravenous route of drug administration. Like the word simply says, intravenous is simply into the veins. So just think of it, this time around, you are taking the drug directly into the veins. You're not taking it through some process before the veins. You are taking the drug directly into the veins. I remember the last time we mentioned that bioavailability of the drug is the amount of the drug that is in the body after it has gotten through the heart. And because this time around this drug went directly into the systemic circulation, it means that we have our intact amount. So if I took 1 ml of drug intravenously, it means that what I'm expecting to work in my body is exactly the 1 ml that was taken in. So everything taken in is what is out. There is no loss at any stage. There is no first pass effect. The drug did not get to be degraded at any point. We did not lose any amount through anything, and it's the drug taken in that will be taken out. So because of the way the bioavailability of the drug is, mostly or most of the times, intravenous drugs are in small quantities and small concentrations. Like any other route, the intravenous route has its advantages and disadvantages. Though I find its advantages and disadvantages more interesting compared to other routes. First of all, it can be used in emergencies. Think of a patient in a very emergency state, or a patient that cannot breathe, that cannot even do anything, and you know that this drug, you can just easily give it in emergency. Why this drug is better than giving intramuscularly in an emergency is because when a drug is administered intravenously, it doesn't need to go through absorption. But remember, in as much as the intramuscular drug was given into the muscle and there are blood vessels there, it will still go through absorption. But this drug goes directly into effect, directly into systemic circulation. So it can be given in an emergency state. So that patient can just be easily given, and we are expecting the results in a very short time. And also it can be administered to unconscious patients, just like the intramuscular route. And also you can give large quantities. Now in this kind of case, when it comes to large quantities, we have to know that intravenous drugs are administered in different ways. First of all, it can be given through a large IV infusion. It can also be given directly, though this is sparsely given, but it can also be given directly into the blood vessel. This kind of administration is called the direct bolus administration. So one of the disadvantages is adverse events. Adverse events is an unexpected event that we're not expecting while giving that drug. For a side effect, it's negative too, but we are expecting this. For example, if I want to administer an anti-malarial medication, I am expecting that at some point this patient can be excessively drowsy. If I'm administering a cough syrup, I am expecting this, but there are some things that you are not expecting. So that's the adverse event, and that's one of the reasons why a nurse or a nursing student is supposed to be very careful while administering drugs, because if you mistakenly do or mistakenly give a large amount of drug medication that was not required by that patient, it is not like the oral drug that we can just easily find a way to induce gastric lavage or through other means for the person to remove those drugs back through vomiting. That is why you have to be careful while administering these drugs. And also, recovery is not easy. When I mean recovery is not easy, we are basically saying the same thing. When a mistake is made, it's very hard for that patient to recover from the already established mistake. So that is why it requires expertise. You can just easily tell a patient, okay, these are your drug medications, take this one, 2 in the morning, 2 in the afternoon. But you cannot go telling somebody to administer an intravenous drug by themselves. So it requires expertise. It requires a medical personnel to administer those drugs to them. So we've come to the end of parenteral routes of drug administration, and please like, subscribe, and share to other nursing students or whosoever will find this video very helpful.